Thanks for watching tonight. In the second half hour, a record one-day increase of COVID-19 cases released today from the South Carolina Department of Health and Environmental Control.
There are 1,741 new confirmed cases and 17 more people have died. Of those deaths, 1 was from Greenville County and 5 were out of Spartanburg County. The percentage of positive tests is also going up. It is now at 19%.
The number of hospital beds in use in South Carolina is increasing as well. Today, our Georgia Godfrey found out how South Carolina is preparing in case there's a drastic increase in cases that leads to a shortage of hospital beds.
Medical professionals and state officials have been keeping an eye on the number of people who have tested positive for the coronavirus and the percent of COVID-19 tests administered that have come back positive. But now they are shifting their attention to another number: hospital bed capacity. Since the first cases of the coronavirus in South Carolina, a team of medical professionals have been working on alternative hospital sites to treat the rising number of patients. And an additional 3,000 hospital beds have been identified.
We have anywhere between 9,000 and 10,000 beds currently if we had to expand during an uptick.
Those 3,000 beds are part of the state's alternative care site plan, which would reserve hospital beds for patients in need of the most intense treatment, placing lower acute patients in converted settings like an office building or hotel.
What you don't want is for a hospital not to be able to care for the communities in which they serve. So it's just a way to help decompress the hospital and deal with external surge.
The South Carolina Hospital Association says once a hospital has 80% of its beds in use, the alternative site plan will come into play. So far, patients have not had to be placed in external care. However, medical professionals are concerned about possible increases in hospital bed usage for reasons not related to the coronavirus.
Hurricane season mixed with flu, mixed with a potential mandatory medical evacuation. All that gives me angst.
New numbers show hospital bed capacity is more than 70%. In Columbia, Georgia Godfrey, 7 News.
Right now, South Carolina is still seeing more patients in the hospital for issues not related to COVID-19.